Welcome to the Thrive Tribe podcast, a place to discover a community of practitioners who can support women to achieve good health beyond just the traditional methods. It's also a place to empower women with the knowledge they need to better prepare their body, mind, and spirit at each stage of their life, from periods through menopause. I'm Chandani Shamwachwani, your host and functional nutritional therapist. I look at each individual's unique needs to manage their long term health challenges and prevent future issues long before symptoms appear, our body whispers. I work together with you to identify those signals and address critical areas to set you on a path of vibrant health and vitality. Our sponsor, Blissamy, is your personal health companion, a smart platform that blends your biometrics, life stage, and wellness goals to create a tailored health journey just for you. Whether you're navigating women's health, chronic care, or mental well being, Blissamy guides you to the right holistic providers, products, and programs all in one place. Today we have with us Ines De Beer, an osteopath in Hong Kong for 25 years. I believe she is the first osteopath in Hong Kong. She is a founder of the Round Clinic here in the south side of Wong Chuk Hong, which has been up and running for 9 years now.
Yeah.
Hi, Ines. Thank you for joining us.
Thank you. Thank you for having me.
We're very
looking
excited.
forward to this podcast. It's my very first one, so I hope I'm doing a good job.
That's great. It's my very first one as well, so we're doing this together.
Great.
Yes.
Great.
So before we get started, I have a burning question because I've heard a rumor about this. Why the name The Round Clinic?
Yeah, I get asked a lot this question, but why the Round Clinic? I meditated on it. I have an interest in everything to do with pregnancy, maternity. So I see a lot of round figures. We see a lot of round bellies.
I love
We see
that.
a lot of round newborn baby heads. Plus, more holistically, the idea that this is a one-stop clinic for anyone, every family member, varying with different ages, from small to big, from young to less young. And so there is this circular movement that I like to envision myself. And I love circles and I love organic fluidity in terms of symbolism. We set it on the Round Clinic.
That's a beautiful story. I think it's wonderful because it's both literal, like you actually can imagine round pregnancy bellies, but also holistic, which is very much how an osteopath approaches medicine, from what I understand.
Sure.
And you've also this clinic is not just an osteopathic clinic, it's many different modalities that can help a variety of different people.
Absolutely.
Right? Yeah. So I was very round when I came to Ines. I was pregnant. I think,
remember.
18 weeks pregnant, if I remember correctly. So before we get started with anything, I want to know, well, how did you become an osteopath?
Yeah, a lot of people don't actually know that it takes at least 4 years full-time education.
Yeah.
So most academies or institutes now is a 5-year program because I graduated before the whole bachelor and master thing. For me, it was 5 years full-time.
Right.
Now they split it up in 3 years bachelor degree, 2 years master. We are masters of physiology and anatomy. You can point to any muscle or area in your body and we know, like all the bones from the hands, especially the skeletal frame, the nervous system, circulatory system, muscular system. So it takes a while to study all this. And once you know the theory, you need to apply it to then the pathologies, the disease, what can go wrong. You need to know what you could treat, what you cannot touch.
Right.
It's a very vigorous, I wouldn't say. If you're passionate, you really love to learn it. But on top of the theory, you need at least, so the proper osteopathic institutes, they will offer clinical hours for their students. And now it's at least 100,000 clinical hours where after all they taught you all the things that there is to know. Are you good with your hands?
Yeah.
Will you shiver when you put your hands on a person? Will your touch be the right touch? Is it too hard? Is it too soft? How are you in communication? Are you a good therapist? Because at the end of the day, you can have the knowledge of a professor, but if you're not good with your tactile skills and your patient approach.
That's actually an area I wanted to ask you a bit more about. You mentioned hands and tactile skills and all having not just the mental knowledge, but also the knowledge of
how do you touch someone, right? How do you touch someone where they feel comfortable, where you feel comfortable and you feel confident? And I've gone to a lot of different osteopaths, and interestingly, every single person has treated me very differently.
Yeah.
Some have been much more hands-on, a lot more adjustments, and some have come just placed their hand under my lower back. And both times I come out feeling much better. With the more
Good.
hands-on ones, it's very obvious to me, oh, something's been shifted, right? But also when it's just a lighter touch, I don't know why I felt so much better. So will you tell us a little bit about how osteopaths help their clients and be
So every osteopath is educated, is taught to diagnose first to listen to what the story is of the patient and the reason they come to see them. And we diagnose. I do have a little roadmap in my head, what we need to change or what we will ask the body to change, and to fire that auto healing mechanism. And there's different ways to do that, and there's different ways of techniques to use. And as an all-round osteopath, you should know all these different techniques. So there is the musculoskeletal approach, which is either by deep, deep tissue releases or massage techniques, soft joint mobilizations, manipulations often. And then there's the more gentler techniques that we can use is the visceral techniques where we work on the organ, and if that is required in that particular case. A lot of osteopaths are using something called cranial osteopathy, where literally we are going to look for obstructions in the flow of a fluid called the cerebrospinal fluid, the CSF, which is a fluid that is made and derives from an area in the brain and flows through the spinal cord all the way to the sacrum and back again. It's a hydraulic movement. This is a fluid, by the way, that they tap if they do the spinal punctures. It's also where they inject the epidural. So it is an anatomical fluid. It is there, but it needs to flow, as the name says. And so we are trained, some better than others, in feeling the obstructions and through different areas in the body.
That's
and
incredible. So
Also where it goes. So it's a root. You have the main root, and then you have smaller branches. And
if I can just inject, I
Yeah.
think what's something really important you said there, it's an anatomical fluid, right? It's
Yeah.
something, so I think a
it's
lot
not
of
a
people,
made-up thing. Yeah.
exactly. I think a lot of people who come are like, what is this thing that they're just trying to unblock, right? What is it? Is it just chi? Is it just energy? Not that chi and energy don't exist, but it's a less tangible thing. This is actually a very tangible thing. You can take it out of your body. People tap it during
the
certain
spinal-
Western spinal taps, right? So you are in osteopathy, the cranial osteopathy that gets done is actually focusing on that entire fluid and the distribution of how it should be flowing throughout the body, right?
And this is called cranial sacral therapy. If it's performed by an osteopath, which is mostly is, we call it cranial osteopathy. And so that's important to know that if you go to an osteopath, that this person has all the tools in their toolbox, and they can just take out what is needed for you, that and not just stick with one certain type of osteopathy.
Yeah, they can actually tailor the healing for that individual. That's great. I actually have a question for you because when I came to you, I was, as I said before, 17, 18 years pregnant. And I ended up with glue ear after an ear infection, which is basically you can't hear intermittently and like your ear gets clogged intermittently for those who don't know what glue ear is. And with that, I went to acupuncturist, I went to lymphatic drainage. I kept trying different specialties to try to help release this glue ear. I went to an ENT doctor. He told me that I had to take a steroid to help clear out the ear. He's like, that might affect the baby because steroids are not good to be taken when you're pregnant. My acupuncturist referred me to you, and I was so grateful. Here's someone with the round clinic for my round belly and focused on pregnancy, as well as she said, master in ENT techniques for osteopathy. And she said, just go give it a try. But, she told me to go to you. And numerous other people said, oh, you should go to a physiotherapist. Oh, you should go to a chiropractor. Or you should go do this. So how do you know which one to go to, right? Why would I choose to come to an osteopath? In what condition?
I think in the past, I would have said that patients are either veering to physiotherapy or chiropractors or osteopaths. Now, the exciting thing that I see developing over the past 5-7 years is that people are combining it more.
Oh,
okay. Especially what I see here, because we do have osteopaths, we do have physios, and so I see that osteopath can be restricted in one thing, physios can be restricted in another. And so that to have that complementary approach to the patient, it's like a firecracker, like it really works. But in general terms, an osteopath is trained to recognize potentially to have a hypothetical plan of where the problem comes from based on the questions we ask beforehand, and to set up a treatment plan, which ultimately would be treating the cause of the problem. Very simplistically said, it's that for people, if you have an injury or like an acute injury, you sprain your ankle, you dislocate your shoulder, if you have had surgery and you need reinforcing, you need toning up, you need exercises, how to like post-surgical care, post-surgical rehab, or looking after your injury or from an accident, I think I would steer people to a physiotherapist. Whereas if you have more chronic issues, like I have people that come to see me with migraine, with patient issues, with
a lot of internal issues also can be here.
internal issues, yes, and or things they don't know what is causing it. Chronic low back pains that are always coming back. And so osteopaths might have a little deeper understanding of what causes things, like an untreated ankle sprain, which I referred to before, which 2 or 3 years later becomes back pain.
Right.
You need to still treat the ankle, not just the back. So that's again an oversimplification that might help your listeners to understand a bit the difference.
Yeah, that makes a lot of sense. Okay, so the second part of my question is, that hallelujah moment for me when I came to you, and it was incredible. You fixed this glute ear that I had been struggling for a month. And within, I think, one session, I felt relief. Within 4, it was gone, and I was on a flight for my baby moon. And then I kept coming to you afterwards until the end of my pregnancy, and we can talk about that later.
My father is an ENT surgeon.
Oh, really? So tell us what inspired you to...
link. I love it. I find it a little bit, it's a challenge, my personal challenge, because I remember my father was very supportive of me studying osteopathy, but I remember very clearly he said he was doubtful that I could help people with symptoms that he was seeing as an ENT surgeon.
Oh,
and I
the challenge.
As a challenge. So I said, oh, wait and see. I think it's only going to be a treatment for musculoskeletal pains, for back pains and neck pains, which secretly he thought, no, we can treat the effects of an ear infection. We can treat 2 ears. I have very good results with dizziness and
dizziness being the vertigo
and and also car sickness and seasickness, like anything related to the vestibular system. Which every time I help a patient with those, I think of my father.
That's actually a very beautiful story. Great. As I said, I was pregnant, right, when I came to you. I think that a lot of our listeners are probably women who are either pre-pregnancy or in their pregnancy or postpartum. What are some common issues that you see come up in these areas? I was walking till the last day of my delivery. I was 38 and a half, almost 39 weeks. And I literally walked around all of Hong Kong. I went and had ice cream at Messina. I walked back up to mid-levels. I was huge. And I was very mobile and felt good. And I had very little pains. I remember as soon as I had a pain, I was making sure I came to you. So you kept me going. You kept me mobile. And I think
that's the thing. We all know pregnancy is the most natural, normal thing for a woman that wants a baby to have, like to undergo. And so for me, the main goal is to give women 9 months of enjoying the pregnancy, not having dizziness or illness or the nausea, not having pains and aches, not having back pain, not having reflux later, not feeling heavy, controlling the swelling. So it's about easing the rough edges and managing possible side effects. And that is something when you talk to most obstetricians, their advice to their patients say, oh, it's normal, just accept. And that is my advice, is that accept it, but do something about it. It is normal, it is natural, but you don't have to undergo, you don't have to suffer during your pregnancy. There's a lot that we can help you with. And so you were categorizing the 3 stages, and I think it's the right thing to do. So before, during, and after pregnancy, and before, I think the goal is prepare your body for conception and for the conception to feel right, and that it's the right time, and optimize your health before. So maybe nutrition is very important during time before pregnancy, and a healthy lifestyle.
What
And
about blood
clearing
flow?
up, clearing up misalignments in your body,
Yeah.
especially pelvic misalignments. So
Right.
by misalignments, by a possible pelvic rotation or a hip rotation, or treating past back pains,
Mhm.
current back pains. Don't go into 9-period gestation with an existing back pain, right?
Right, yeah.
So you clear up all these little things and make sure that there's no underlying or existing issues,
Yeah.
right? Whether that is a symptom that you feel, a pain that you have in the back or tummy, or whether you don't know and there's a rotation in your pelvis, but you have no idea that it is there.
That's actually really interesting. So
Yeah.
you don't know that your pelvis
No.
might be rotated, and that's, from what I've heard, is also can cause a lot of fertility issues as well, right? If you have some kind of anatomical misalignment, it can be
Yeah.
difficult to keep a pregnancy as well.
Yeah.
So
It's never one cause. I will
Right.
never claim that because of a hip rotation, that person has issues
Right,
with
right.
conceiving. Always a combination of things.
Right.
But work through that list. And it doesn't take a lot of sessions. It takes maybe 2 or 3 sessions just for us to make sure that, we have realigned your pelvis, we worked on tensions that you have in your lower abdomen, we have looked at your lumbar spine and there's no blockages there, everything goes well. I've done my part.
Yeah.
You work on your nutrition, maybe go see an acupuncture and preparation
Yeah.
for it. You work with relaxation or meditation. I think that it's different for every patient.
Right,
But,
right.
but our side, in terms of fertility, is actually the musculoskeletal side. Yeah, because we do have nerves originating in the spine and brain going to the
Yeah.
reproductive organs, and that is one side on the physiological side. But then for people to understand easier is if you the pelvis, as you can see there,
Yeah.
it is a kind of a ball. Left and right has to move. It is a moving entity, and we want the mobility there. We want symmetrical mobility. So this is easy to detect for us, and to then treat it,
Right.
to correct it. And like I said, 2 sessions, most of it.
I actually wanted to ask you, you talked about the mobility and all of that, which sometimes can be very obvious to people, but you also mentioned like acid reflux
Yes.
and nausea. And
Very common.
those are people would not even think to come to an osteopath for that. So if you,
Yeah.
interesting that you can work on both kind of these more.
Because the body changes, especially with reflux. Generally, you have that mid-pregnancy, anything around 16 to 25 weeks. Some women, I was one of them, I had a lot of reflux, and I went to see Colin who treated me for that during my pregnancy. It's related to the diaphragm. It's related to the changes your body goes under
Yeah.
during the physiological changes. When your belly grows, it makes way. One of the ways it has to give is the bit go up and out. That changes, for example, I don't want to go into technical things, but that changes the tension of your diaphragm. Your stomach goes through the top of the stomach goes through the diaphragm, and the diaphragm gets tight. It can pinch your esophagus, and it can create reflux. Like that's one side on it, and then you have a neurological connection through the nerve, to the vagus nerve. Okay.
And it's so much safer, or at least emotionally and mentally safer. You don't have to take a pill. I think if you go to a doctor, often they'll give you anti-nausea medicine. And when you're pregnant, you often fear taking anything that could possibly harm the baby, right?
Yes.
So
Yeah.
even though most medicines are okay, you still tend to be more conservative. And I think what's amazing is that you can actually find healing and relief through osteopathic medicine, which does not require that. Right?
It's totally natural.
It's totally natural,
and
yeah.
safe. The patient would be lying on the side. In terms of with regards to reflux, be lying on the right side, double pillows, knee roll between the knees.
Yeah.
It's super comfortable
Yeah.
position. And we work on freeing up in the ribs, getting more mobility in the ribs, getting more mobility in the diaphragm, checking out tensions, whether it's neck or mid back in that case.
Yeah.
Very relaxing, actually.
I felt better every time. Yeah.
And you feel better after.
Yeah, you do.
Yeah. So relatively safe, and I want to stress that. Can I just say something
Yeah.
more about it during pregnancy? The most important thing is to stay mobile.
Yeah.
If you don't have pains or aches, you don't have to come see anyone.
Yeah.
But treat us, continue with your a healthy lifestyle, stay, move around, go for walks, go to a stretch class. Don't be afraid of being pregnant. Life goes on, and just look after yourself. And mobility there, movement.
That's very important. Yeah. I remember you telling me that and giving me lots of anecdotes of that.
Yeah.
So that's great. What about postpartum? No, I'm in that phase
Postpartum.
right now.
Yeah.
I've not really had time to take care of myself. And my son is now 9 months old, and I feel like I'm just coming out of the fog. We had a tough time with his health. We had a bit of a health scare with him, and now we're overcome that. And now I'm postpartum, and I'm thinking, how can I help myself? What can I do to feel better? My core is gone. My back is gone. So how I
Postpartum, from an osteopathic point of view, is actually go first. And I'm talking against my profession here, but I really believe it. We need postpartum rehabilitation, and there's a lot of physiotherapists who are specialized in that and in women's health rehab with postpartum, and where it's important to strengthen your pelvic floor. And I'm talking about 0 to 6 months postpartum. So that is the go-to first.
physiotherapy.
Yeah, physiotherapy.
Okay.
By a registered physio who specializes in that. And then anything that is pains and aches, and if you have low back pain, neck, because don't forget you have a baby to carry. If it's breastfeeding or bottle feeding, you need to carry it. You need to hold it. And because they're so damn cute, sorry, because
They are. That's why you stay
we
home
look
with them.
down at them, and our necks go often like in 60-degree angles.
Yeah.
Looking down.
Yeah.
So neck pain is actually, I think, the top one symptom that I see new moms for.
Yeah.
Neck pain, paresthesia in both pins and needles and arms and hands from holding the baby, looking down. So that it's definitely a neck issue, which then also in some cases can go into headaches or neck pain, and then low back issue. Yeah, so treat the symptom. Go see an osteopath when you have symptoms. Get people pain free, and then the alignment, depending if it's a natural delivery, if it's not a vaginal birth or it's C-section, there's different things to look at. We look at alignment again, the pelvis and diaphragm, lower ribs, just to get that body back into its pre-pregnancy state a little bit.
Women in the workplace are often silently suffering from all of these aches and pains, especially during their pregnancy or postpartum. I've been fortunate enough to be at home and try to have some time to do some yoga or do some stretching just to relieve the pain. I haven't had much time to get out of the house. But if you're going to work every day, you don't have, and you have a family at home, and you have all these aches and pains, it's hard to find time for yourself to do things. And I think that's really what the struggle is for a woman in the workplace, where you're balancing home life and work life and this new body and set of aches and pains you have postpartum or during pregnancy, right?
So I think what can we change?
Yeah.
Talk to your boss if there is a little bit of wiggle room with the working hours.
Yeah.
Check out your ergonomic workstation. Maybe look for a really good chair if you need to change your chair. If you want a standing desk or you want a fit bowl to sit on and to change your pressure on the lower back, so check out that. A lot of companies and the employees, they don't always let them know, or the employees don't know, but a lot of companies have budgets set aside actually for that and their wellness program. So I would check that, and definitely movement. If people ask if I see patients, if I don't see patients for many years and I run into them and I ask them how they're doing, and they tell me they're doing well, and I ask them how they manage their work-life balance and their pains and they always say they're staying mobile, whether that is with stretches or with yoga. So my first advice would say not straight away after you had a baby.
Right.
And not during your third trimester of pregnancy, but anything before and after, incorporate at least one yoga class in your week.
Okay.
You have no idea what a difference that will make to have a body that is literally more supple. Muscles are elastic fibers. Elastics need to be stretched back and forth. So movement outside the office is very important. Make time. You don't need to sign up for a 20-class yoga. There's now, since COVID, there's a ton of information or platforms like YouTube, free yoga. And then the second thing is during the workday, look for stretches to do in the office and do them.
Yeah.
And if you go to a meeting that is three hours, look for symmetry. Have your main conversational partner sitting across of you, for
Right.
example, and don't have a 3-hour meeting looking to one side with your neck totally 90-degree turn,
Yeah.
because that you'll pay for it afterwards. So be wise and clever about keeping your body in the most aligned, symmetrical way. Not sitting like I'm doing now, but
Or me.
sitting on both.
Yes, let's
both
adjust our chairs
sections like that,
after
you
that
know?
little bit of a reminder.
And movement.
Yeah.
Right? And so that this is the most important.
And awareness of how you're tilting your body, like you just said, and for
Yes.
long periods of
Movement
time.
and symmetry.
Movement and symmetry. Okay. I think something you shared with me in the beginning, and it just keeps reminding me, is osteopathy has given you the power to take care of your family, run your own business, as well as have a thriving career that you feel like you love and making an impact on people's lives. But every profession has its hard days, right? What are some of those anecdotes or cases that you can share with us that really keeps you going on those hard days?
I have a lot of them.
Yeah.
And I don't have that many hard days.
Okay.
Like the idea of coming to a place where I can help people and knowing that I can help them most of the time.
Yeah.
That is, for me, I don't need my coffee in the morning. I have my coffee in the morning. But mentally, I'm being honest. Like, there's actually rarely a day where I don't want to help, like where I am like off days. But memorable cases, one that I will always remember, actually it was in Belgium, was when I was working under supervision in the 5th year. You're working as a junior osteopath, but you're supervised by osteopath. And so it's a clinic that was associated to the school. And we had a girl, an 18-year-old, who was 1.5 centimeters too short to be accepted in the police academy.
Oh, 1.5 centimeters. Okay.
Too short. I think at that time, there was a minimum in height.
Yeah.
I don't think there is now. They would, but she needed to be of a certain height, like 1.6.
Okay.
And she was nearly like over a centimeter too short to make the cut. And she tried twice, and they would measure her, and she would not make the minimum height requirement. And she was very sporty, I remember. I can't remember what sport she did, but for sure there was like we worked on the spine. We worked on lengthening her spine.
Wow.
And blocking the blockages, like getting rid of all the tension, getting rid of the compression factors in the spine. We have a lot of vertebrae to work with. And if we get a little bit of release in every single muscle, fascia, ligament around the spine, we lengthen the spine.
Oh my gosh, you made someone taller.
It's not just I was allocated to her, but she was allocated to me.
Yeah.
But I wasn't the only one working her. I complained, I think, only. But she made it into the police academy. So we worked on her a little bit. It was 7 or 8 sessions. I won't say it's only a few.
Yeah.
But she made it. And she sent us a postcard from the police academy. That is a funny story.
You made someone's dream come true.
I was always planning about. And then there's others.
Sorry,
Flowers that was here in Oak Hall. I helped a baby sleep through the night or sleep better and crying less because I can't remember exactly, I think. So I worked on improving its digestive system. Stomach cramps, it's a colicky baby, slept better. And in doing so, you're not only helping the baby, you're helping the parents.
You are, yes. Well. How old was this baby?
Like around 3-4 months.
Okay.
Yeah, that's a while ago. And I got flowers delivered in clinic.
I still have to bring my child to you.
Thank you. No, that makes not just your day, that makes your life. Like,
absolutely. You made their life, to be honest.
And
I think that's something we need to highlight as well. It's not just postpartum for you, but it's also now you have this new human in your life, and osteopathy can actually help a baby, a very young baby, a 2-week-old baby or a 3-month-old baby. That can in turn help you, like you just said. That's beautiful. I think we're coming to the close of our
Mhm.
podcast, but I wanted to ask you a question. Being a woman, having a family, raising two
Yeah.
boys, right? And also as an osteopath, you've seen so many women come in and come out. What is the one single, or you can get a couple pieces of really critical advice you want to give them for a healthier life?
To make time for yourself. And that sounds cliche. And everybody says, yeah, I know. Like, really, the world will not stop because you take half an hour a day for yourself.
Yeah.
And to whether that is or an hour meditating or going for a facial that relaxes you so much, or closing the door, lie down and take a nap and switching off your phone. I think, especially in a busy city like we are living here in Hong Kong,
Yeah.
after 24 years, and people commented like, "How can you stay here so long? Because it's such a vibrant, energetic,
It is.
tiring, exhausting city." That's
Yeah.
how often Hong Kong is looked at. But it's about balance, and it's not just about work. It's not just about being a mom. You also need to protect yourself
Yeah.
to be able to continue those two other things, to be a good mom and
Yeah.
to be good at your work and to enjoy those things. And I realize it a luxury.
Yeah.
And
It makes you a better
yeah,
mom. It makes you a better,
yeah,
makes you
yeah.
happier.
And we need to protect ourselves, that we keep going first and foremost, that we are happy and content with our life. We pass that on to our environment,
Yeah.
whether it's work or the ability to that motherhood as it gives us a challenge.
I think a lot of time the happiness also comes from feeling good, right?
Yes,
So
yeah,
making sure it's
yeah,
whether, like you said, it's a hair appointment or whether it's
yeah,
a massage or a yoga
yeah,
class or deeper healing that you might need
yeah.
going to a physiotherapist or an osteopath or
Taking up a passion or taking
Yeah.
time for yourself.
yeah. And we also are examples for a future generation. So it's very important to make sure that we are living our best life.
Yes.
You don't want to be
Yeah.
sitting there depressed and taking care of your
Yes.
family.
Yeah.
So
Yeah.
yeah, absolutely.
Definitely.
Thank you so much for coming on the podcast.
Our very first.
Very first podcast. I'm so glad you listened. We are so happy we had Ines De Beer here with us. And I've said this a bunch of times in the podcast, but I can't recommend her more. She helped me so much during my pregnancy. And I think I'm still delinquent. I need to come back to her for
Yeah, all the time.
Yeah.
I'll be here. I'm not going
Yes.
anywhere.
Yes, exactly. So thank you so much. And bye.